Welcome to Nursing Prep. Push yourself in nursing preparation with Smart Way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. A patient with no known allergies is to receive penicillin every 6 hours. When administering the medication, the nurse observes a fine rash on the patient's skin. The most appropriate nursing action would be to: Option A. Withhold the moderation and notify the physician. Option B. Administer the medication and notify the physician. Option C. Administer the medication with an antihistamine. Option D. Apply cornstarch soaks to the rash. Right answer is Option A. Withhold the moderation and notify the physician. Initial sensitivity to penicillin is commonly manifested by a skin rash, even in individuals who have not been allergic to it previously. Because of the danger of anaphylactic shock, the nurse should withhold the drug and notify the physician, who may choose to substitute another drug. Administering an antihistamine is a dependent nursing intervention that requires a written physician's order. Although applying cornstarch to the rash may relieve discomfort, it is not the nurse's top priority in such a potentially life-threatening situation. All of the following nursing interventions are correct when using the Z-track method of drug injection except Option A. Prepare the injection site with alcohol. Option B. Use a needle that's at least 1 long. Option C. Aspirate for blood before injection. Option D. Rub the site vigorously after the injection to promote absorption. Right answer is Option D. Rub the site vigorously after the injection to promote absorption. The Z-track method is an IM injection technique in which the patient's skin is pulled in such a way that the needle track is sealed off after the injection. This procedure seals medication deep into the muscle, thereby minimizing skin staining and irritation. Rubbing the injection site is contraindicated because it may cause the medication to extravasate into the skin. The correct method for determining the vastus lateralis site for IM injection is to: Option A. Locate the upper aspect of the upper outer quadrant of the buttock about 5 to 8 centimeters below the iliac crest. Option B. Palpate the lower edge of the acromion process and the midpoint lateral aspect of the arm. Option C. Palpate a one circular area anterior to the umbilicus. Option D. Divide the area between the greater femoral trochanter and the lateral femoral condyle into thirds, and select the middle third on the anterior of the thigh. Right answer is Option D. Divide the area between the greater femoral trochanter and the lateral femoral condyle into thirds, and select the middle third on the anterior of the thigh. The vastus lateralis, a long, thick muscle that extends the full length of the thigh, is viewed by many clinicians as the site of choice for IM injections because it has relatively few major nerves and blood vessels. The middle third of the muscle is recommended as the injection site. The patient can be in a supine or sitting position for an injection into this site. The mid-deltoid injection site is seldom used for IM injections because it: Option A. Can accommodate only 1 milliliter or less of medication. Option B. Bruises too easily. Option C. Can be used only when the patient is lying down. Option D. Does not readily parenteral medication. Right answer is Option A. Can accommodate only 1 milliliter or less of medication. The mid-deltoid injection site can accommodate only 1 milliliter or less of medication because of its size and location, on the deltoid muscle of the arm, close to the brachial artery and radial nerve. The appropriate needle size for insulin injection is: Option A. 18G, 1.5 long. Option B. 22G, 1 long. Option C. 22G, 1.5 long. Option D. 25G, 5/8 long. Right answer is Option D. 25G, 5/8 long. A 25G, 5/8 needle is the recommended size for insulin injection because insulin is administered by the subcutaneous route. An 18G, 1.5 needle is usually used for IM injections in children, typically in the vastus lateralis. A 22G, 1.5 needle is usually used for adult IM injections, which are typically administered in the vastus lateralis or ventrogluteal site. The appropriate needle gauge for intradermal injection is Option A, 20G. Option B, 22G. Option C, 25G. Option D, 26G. Right answer is Option D, 26G. Because an intradermal injection does not penetrate deeply into the skin, a small bore 26G-27G needle is recommended. This type of injection is used primarily to administer antigens to evaluate reactions for allergy or sensitivity studies. A 20G needle is usually used for IM injections of oil-based medications, a 22G-25G needle for IM injections, and a 25G needle for subcutaneous insulin injections. The physician orders GR10 of aspirin for a patient. The equivalent dose in milligrams is Option A, 0.6 milligrams. Option B, 10 milligrams. Option C, 60 milligrams. Option D, 600 milligrams. Right answer is Option D, 600 milligrams. GR10 by 60 milligrams / GR1 equals 600 milligrams. The physician orders N4 solution of dextrose 5% in water at 100 milliliters/hour. What would the flow rate be if the drop factor is 15 GTT equals 1 milliliter? Option A, 5 GTT/minute. Option B, 13 GTT/minute. Option C, 25 GTT/minute. Option D, 50 GTT/minute. Right answer is Option C, 25 GTT/minute. 100 milliliters / 60 minutes x 15 GTT/1 milliliter equals 25 GTT/minute. Which of the following is a sign or symptom of a hemolytic reaction to blood transfusion? Option A, hemoglobinuria. Option B, chest pain. Option C, urticaria. Option D, distended neck veins. Right answer is Option A, hemoglobinuria. Hemoglobinuria, the abnormal presence of hemoglobin in the urine, indicates a hemolytic reaction, incompatibility of the donor's and recipient's blood. In this reaction, antibodies in the recipient's plasma combine rapidly with donor RBCs. The cells are hemolyzed in either circulatory or reticuloendothelial system. Hemolysis occurs more rapidly in ABO incompatibilities than in RH incompatibilities. Chest pain and urticaria may be symptoms of impending anaphylaxis. Distended neck veins are an indication of hypovolemia. Which of the following conditions may require fluid restriction? Option A, fever. Option B, chronic obstructive pulmonary disease. Option C, renal failure. Option D, dehydration. Right answer is Option C, renal failure. In renal failure, the kidney loses their ability to effectively eliminate wastes and fluids. Because of this, limiting the patient's intake of oral and IV fluids may be necessary. Fever, chronic obstructive pulmonary disease, and dehydration are conditions for which fluids should be encouraged. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.